Can COPD patients get disability benefits? Imagine facing daily struggles just to breathe and wondering if your hard work and efforts will be recognized by the government. If you have chronic obstructive pulmonary disease, or COPD, you might be eligible for disability benefits. These benefits can provide financial support when your lung health makes it impossible to keep working. The key is whether your condition seriously limits your ability to do your job or perform everyday activities. To qualify for Social Security disability insurance or supplemental security income benefits, you need to show detailed medical proof. This includes your medical history, treatments you've tried, and how your lungs have changed over time. Doctors will provide physical exam notes, imaging scans like X-rays or CORT scans that show lung damage, and pulmonary function tests. These tests measure how well your lungs are working, including spirometry, which checks airflow, and blood tests that measure oxygen and carbon dioxide levels. If you need supplemental oxygen, that documentation is also important. The Social Security Administration uses specific rules from their Blue Book, especially Section 3.2, which covers respiratory disorders. If your lung function tests show a forced expiratory volume in 1 second below a certain level, you might automatically qualify. If not, they look at your residual functional capacity, which considers what you can still do despite your limitations. The process involves 5 steps. First, you must not be earning above a certain income. Next, your condition must last or be expected to last at least 12 months or result in death. Then, your impairment must meet or be equal to the criteria listed in the Blue Book. If it doesn't, they see if you can still do your past work. If not, they decide whether you can do any other work based on your age, education, and work history. For example, someone over 50 might find it easier to qualify because they only need to prove they cannot do their previous job. Younger people need to show they cannot perform any work available in the economy. For patients and caregivers, gathering thorough medical records, treatment history, and detailed doctor statements about how COPD affects daily life is essential. Caregivers can help organize this information and assist with the application process. Legal and financial planning resources stress starting early, so you're prepared when your ability to work declines. In short, if COPD severely limits your lung function and daily activities, you may qualify for disability benefits. The process depends on detailed medical evidence and how your condition impacts your ability to work. Support from professionals and caregivers can make the application smoother, ensuring you get the help you need during difficult times.